student in Sales Community College. So before I will start, can I ask for your name and date of birth, please? Okay, very good. So would you mind if I'm going to sanitize my hands before I start my assessment? So, the doctor prescribed breathing treatment, which is an inhaler. So the inhaler will be done in a dry powder inhaler. It is similar to what I performed a while ago, which is in MDI, but in a powder form. So before I proceed in my instructions, I will assess the patient. So I'm going to listen to the breath sounds, check the respiratory rate, get the heart rate, the blood pressure, peak flow measurement, and even trying to check the pulse oximetry, the level of O2 saturation. So now that I'm done taking up the assessment of the patient, I'm going to instruct the patient how to perform and demonstrate it to the patient. So this one is the dry powder inhaler. So this one is non-invasive, just for your for you to know, any idea. So all you have to do is just sit upright and then just relax, and then before putting this one in the mouthpiece, you have to exhale all your air out, and then this device should be away so that it will not prevent any clamping due to humidity. Okay? And then once you feel that there will be no air remaining, you have to put this one inside your mouth, and then when you put inside your mouth, you're going to do a deep inhalation. Once you do your deep inhalation, you hold your breath for at least 10 seconds or as long as you are comfortable or able to do so, and then remove this one. After you remove it, you exhale slowly. Okay? So can you do this one for me right now? So then exhale all your air out. This device should be away from it. And then after that, you put this one inside your mouthpiece, in your mouth, and then it should be sealed by your lips, and then you do rapid deep inhalation. And then once you do this one, you're going to hold your breath for at least 10 seconds, and then after that you remove this one, and then after it you exhale slowly. So because you are given a corticosteroid, I'm going to give the patient a glass of water. So here is a glass of water. So what you're going to do is you have to rinse your mouth, gargle it. So for your own sake, just to prevent any thrush because of the corticosteroid. And then after that, you have to dispose all of it. And then by the way, if you're able to cough or expectorate some sputum, can you do this? Can you do it for me? So I'm going to assist the patient also, because the patient is able to expectorate or cough by tapping or percussing the back. So now that I'm done taking the administration of the inhaler, I'm going to reassess again the patient, such as what I did earlier by taking up the breath sounds, heart rate, respiratory rate, O2 saturation, blood pressure. And then once I'm done doing it, I'm going to wash my hands. After washing my hands, I'm going to inform the patient and educate them on how to track the doses. And then after it, I'm going to tell the patient on when can they possibly go back if in case they need to be taught again on how to do the inhaler, the proper way of doing it. So this one, the inhaler, there's a tracking doses where you can see. so that you can label it, write it down, so that you'll be able to track it when possibly the inhaler be due. And then if in case you need some assistance in how to do the inhaler again, don't hesitate to call the office or even drop by via walk-in, so that I can personally, or one of my staff can personally do it in front of you again. Thank you so much and have a good day.